Hello and welcome to the CSR Universe Leaders Talk, a segment where we spotlight change makers driving purpose with impact. This July, we mark Cleft Awareness Month, and in this regard, we're proud to have Ms Shanu Saxena, Chief Compliance Officer Asia Pacific at Haleon. Under her guidance, Haleon India has supported over 7,500 cleft surgeries in partnership with Smile Train India. This makes them one of the top three funders of Smile Train. In today's conversation, we'll explore why cleft care deserves more attention in India's public health efforts and how Haleon is fulfilling its broader purpose of better everyday health with humanity. So, Shanu, thank you so much for joining us. It's an absolute pleasure to have you.
Thank you so much for having me, Shweta. It's an absolute pleasure to be able to share Haleon's journey on CSR and how we are actually focused on cleft.
Wonderful. So let's just get right into it. I just mentioned that you work with the guiding purpose of delivering better everyday health with humanity. So it's a beautiful philosophy. So how does it shape your CSR efforts on ground in India?
Yeah, so like you said, Haleon's purpose when we got, separate listed, was to deliver better everyday health with humanity. Now, this shapes everything that we do, even in India, through our CSR programs, especially for the underserved communities, by trying to address both social and environmental barriers to health. Our commitment is to make sure that the CSR programs focus on enhanced access to oral and primary healthcare for the marginalized communities and breathe clean initiatives. We've expanded quite a lot in terms of trying to get oral healthcare for the communities, free treatment to those who need it most through our mobile oral healthcare units.
Mhm.
And we run them across India, right? So we've got some educational programs also, which is in partnership with IDA. So it's the Sensodyne IDA Shining Star Scholarship Program, where we try and bridge the learning gap for meritorious underprivileged students for dental courses. And then our partnership with Smile Train, which is what we're actually celebrating this month, is to give quality surgeries totally cost free for the underprivileged children. And from our Breathe Clean perspective, we've got Green Yatra as a partner who helps us build urban forests. And we've done two of them in Delhi. So together, these initiatives, are deep commitment towards making, healthier communities through compassion and inclusion in everyday, life for us. Yeah.
So coming to cleft care, I think you're in partnership with Smile Train since 2018, right?
That's right.
And so initially, what inspired you to get into cleft care? So, and
Yes.
how has it evolved, over the years, your initiative?
Okay. Yeah, so you're right. So 2018 is when we got into this partnership. And through this partnership, we've supported more than 7,500 surgeries. What really inspired us to focus on cleft was to elevate and reduce the burden of cleft in India. And it's kind of an area which is quite heavy. And we found Smile Train Foundation doing great work in this. And so we've, kind of worked with them together to create high quality, safe cleft surgeries for underprivileged children. Now, what has happened over a period of time is the journey has expanded, and there's been surgical interventions that we've done. We've also encompassed holistic support, which is speech therapy, diet consultation, all of that beyond the surgery that we've been able to do. Smile Train today serves in about 90 countries, and they have a very comprehensive treatment for children, and they treat cleft lips and palate. In India, in our collaboration, we've actually benefited 25,000 families plus. And as I said, completed about 7,500 surgeries already. And we want to continue this partnership. What are we very proud of is we were working together to establish the first National Cleft Helpline. Until today, even after so many years, it's the only helpline that's available totally toll free for the communities and be able to service people and give any kind of help which is needed for people who are impacted and who are trying to find out more about cleft.
Could you tell us more about the helpline? What the volume of queries that you receive and the kind of help that, how does it help people, get the access and care and the counseling that they need?
Yeah, so it is one of its kind, toll free totally, and it's national level, So we're very proud to support that because we're the only partners who are supporting it, and today we are able to support 9 regional languages. You have to understand that when people call into these seek help, they are not always comfortable with Hindi or English. So
Right,
initially
right.
we started with Hindi and English, but then we've gradually been able to bring in some regional languages. It is kind of helping us serve the underserved communities by breaking language barriers, ensuring that the families have been able to get support and make sure that people are very very clearly available. So far the helpline has actually reached out to 9,000 people, and they've been able to support quite a lot from that perspective. So it's more than 9,000 calls attended. They also follow through and make sure that the families who have called in, have they reached a hospital? If they need any aftercare also, that's also possible. It's quite possible to be able to support them through the helpline. Yeah.
Um, so we were talking about public health efforts, and cleft care probably does not get the kind of attention that maybe other health issues do get. Do you agree with this? And what can we do to, highlight this issue probably? Because when we talk of healthcare, cleft care doesn't naturally come to mind, particularly when we're talking about public health. So, what's your take on that?
Yeah, so actually, if you look at it, cleft care and awareness is often overlooked. It's lack of awareness in a lot of people because this has multiple factors that have been historically, I think, associated because cleft has been seen like more of a cosmetic surgery, not something which is going to impact the health of the person. It's only through education that people have realized that speech is impacted, feeding is impacted, and even the social integration is impacted. And that brings down the confidence of the child quite a lot. So, with this limited awareness, I think people have not really dwelled into asking for help and trying to treat the condition. Hence, the public health resources are frequently prioritized for diseases which will spread, which are
Right,
infectious,
right.
which are chronic in nature and largely impacting day to day life. Here, walking and talking is slightly different. Walking, if you can get to a place, you are fine, you feel okay. Maybe I'll be able to communicate in some other manner. But here, when children are born with cleft, they have huge difficulty with speech, feeding, and of course, confidence. So, we at Helion have been actively trying to address the gap and to make sure that the awareness level on cleft really comes up and we can address the cleft care in a longer way.
So you've done so many, you've supported so many surgeries and you work so closely with Smile Train on the ground. So are there any particular stories that come to mind, that sort of capture the gist of what you do or the beauty of what you do in class?
Yeah, so I'll actually tell you about the first baby that we had, baby
Okay.
Jaya. She was our first surgery when she was a very little baby. And today, after so many years, she's got a beautiful now smile. She's able to talk. In fact, she had an oration award, and her father was very proud to write back to us and share with us that. She's now able to even perform on stage and speak well. So great inspiration we get out of that. Other than that, we've got many powerful stories. I can share a few for your interest, but many powerful stories are there, and they're really heart moving. So Sanjay Pradhan's story is very powerful. He's from Cuttack, and he faced quite a lot of difficulty in feeding, and of course social stigma of how the appearance was. And then he got to know about Smile Train, and because of financial hardship, he had to look for free surgery. And the hospital that he was actually going to for childbirth referred him. So Ashwini Hospital was, referred, and he went there. And today, the child is 4 years old, has a beautiful smile, and of course, hope and resilience to be able to kind of take it forward. Then there's the inspiring story of Ankita, who's the, kind of very courageous girl. And her parents turned the fear and kept her away for a long time and kept praying for help. And what they realized was, when they started to have the conversations quite a lot, they got to the local health clinic, and they introduced her to Smile Train. And that transformation obviously has come about so well that Ankita now signs up to become a doctor in the future and try and help other people. Similarly, there is a story about Saras from Rajasthan, again born to Guru Charan and Lakshmi Bai, overwhelmed and very uncertain how the story is going to kind of go forward, how life is going to treat them. Feeding was very difficult for him. Again, social stigma attached to it. He got in touch with Dubey Hospital through the cleft treatment program in the education that we even provide to the Anganwadi workers, who are actually feeders into the hospitals and help people get there. And Dubey Hospital actually trained and very well equipped, did the surgeries, and now Saras is able to eat, speak, and breathe better. He's now 9 years old, loves playing cricket, goes to school very regularly, and has a large group of friends. So happy to share some stories that we've actually been associated with. But I'm sure each story is really powerful, because for me, it may be one surgery, but for that child, that individual, it is the life for the person. And for the parents, it's their child. So it's hugely important for
Thank you
them.
so much for sharing those stories, because no matter how we talk, how much we talk about numbers and metrics, but it's unless you know the stories behind it, the person whose life has changed. I mean, then you realize what a privilege it is to be doing the kind of work or be in this area. So thank you for sharing those stories. And now moving beyond cleft care, Haleon also works with a number of other organizations, right? You have partnerships with Save the Children and WHO, Save a Mob. So could you tell us more about these collaborations first, that you have with different organizations and what you do with them broadly?
Yeah, so like I said, in the initial part, our focus is healthcare
Right.
and trying to build the infrastructure around healthcare. So there are two ways we've approached it. One, we've detailed about the Smile Train piece. The other thing we've done is we've got mobile units, fully equipped a dental clinic, and this is with partnership with Doctors for You and Smile Foundation. And now we have 6 of these units which run around Gurgaon, Agra, Mumbai, Noida, and two in Delhi. And each of these units has a registered dentist, a community mobilizer, and they've served more than 150,000 people over the last 3 years that we've been operating, right? Then our mobile primary healthcare units, also 3 of them that we have, and they serve Himachal Pradesh, Andhra Pradesh, and Karnataka. Again, each is housed with an MBBS doctor, a trained nurse, and a community mobilizer. Again, these units have been able to reach across more than 120,000 people since the time we've started operating. You mentioned Save the Children. We worked with them very closely last year during the Himachal floods, and we distributed some shelter kits, and that impacted 6,500 lives. And it is very difficult terrain. So even our Himachal van for primary healthcare was part of the disaster relief program. So that's how we kind of tied up both the programs. Then, in collaboration with IDA, we've actually built the scholarship program where we've supported 280 scholars till now, and we continue to do that. What we do is we secure the entire 4 years' money for the student in the first year, but we disperse it each year for them. So 280 scholars, again, trying to build the dentist ratio for India is where we want to kind of go. Then, lastly, we've done the Green Yatra partnership to be able to plant 1 lakh trees in Delhi. Capital of India always has pollution issues. So that's why our focus is on that. And these dense forests using the Japanese Miyawaki technique actually create very good environment. Like the one that we have in Dwarka, Delhi, has already got 35,000 trees, which are very mature, and they
Mhm.
save about 7 lakh kilograms of carbon dioxide annually. Similarly, the 65,000 trees that we've planted in SGT Nagar towards the highway, in a year's time, or maybe a few months after the monsoon, will continue to now give us, similar benefits of clean air, breathing clean around. So the societies around that get a lot of benefit from that. So those are the, partnerships and the programs that we run.
So, you have such extensive CSR initiatives, and you would be having larger ESG goals. So, because you're leading those efforts, so how do you align these two efforts, your on-ground initiatives, with your broader ESG and sustainability goals? Because that's something that a lot of organizations are thinking in that direction and working towards that.
Yeah, so ensuring ethical consistency requires, long time, strong, value-focused frameworks, like you said. So both globally as well as locally, we've adapted quite a lot. At Haleon, we've established a unified code of conduct that applies to all our employees, contractors, and third parties, irrespective of the geography, activity, or function that you work in. We've also got our commitment to health inclusivity in a big way. And it's a core part of how we do business, right? It's the how part of it and stands for who we are. So we supported the Health Inclusivity Index in partnership with Economist Impact. And this helps us understand the global health landscape by assessing health inclusivity across 40 countries. Globally led program. The effort was specifically targeted to study how underserved communities and groups are able to get to, health information, health literacy, how lower income women and people aged 50 and above can get information. We focus on these groups because there is a significant barrier to qualify, get quality healthcare. Now, the index measured economic, health, and social benefits that result from addressing the health inclusivity gap. This means, quantifying how improved health would actually be able to give more access to healthcare and increase health literacy. Our findings were, very, very important, and they came up with three key calls for the policymakers. One was increasing health literacy, so empowering people and communities through inclusive health literacy, involving information available to everybody to manage their own health. How can you take care of yourself? Prevention is better than cure, right? So how can you get more preventive about it? Then have health systems that provide equitable access to healthcare. not to create a divide on where the healthcare is sitting, but make sure it can reach, removing barriers so that everyone can actually get to that point. And lastly, in terms of trying to embed it in the society, recognizing that health is influenced by a lot of factors like education, environment. So how do you embed health inclusion across the society? We are committed to make this change. We believe the effective programs will come about, and working with various sectors to build healthier communities is our objective.
Wow. Thank you for talking about that health inclusivity index. And I'm sure there are so many gaps in India that are there. And you've been in this domain working for so long. But on a personal note, or on, in your opinion, what do you think? Health is a very broad issue, but I'm still asking that question. That where do you think are the largest gaps? Where should we focus our most immediate and urgent attention today when
Yeah,
it
so
comes to public health, improving public health?
I think, championing the whole piece on getting people to understand what it takes, increasing the awareness, increasing the literacy by itself, and this is supported by the study only, will actually save India by, 12 billion annually on healthcare cost. And
Okay.
just by improving 25% of the health literacy. So that kind of saving can come in just by self awareness, the prevention part of it. If you know how to take care of yourself, some larger diseases can actually be prevented much early. So a stitch in time saves nine, right? That's the analogy even in healthcare that we can use. Access also is a big part, nationwide educational campaigns to be able to make sure that oral health care, anemia, muscle health, skeleton, bone health, all of these can be improved. For example, people don't understand that diabetes can even be caused because of bad gums. And just by making that education, probably $3.5 billion can be saved from diabetes care. India is going to become the diabetes capital. That's what people are saying, right? If we look after the gums, maybe we can prevent that from happening in the longer run. If we make sure that people take care of their health with making very good interventions around anemia, women impacted, can we make sure they eat right? Can we make sure that they are following the norms? There's the UN SDG norms also on anemia, right? So if we start to look after muscles and skeletons and bones in older adults and women, we could actually end up saving 3 billion pounds there as well. Again, the quality of air that we breathe is very, very important to kind of look at it. WHO standards actually call out India's pollution level. If it was improved, could unlock quite a few dollars for us, and it could actually end up in being economic gain for us. The crux of the index is health literacy and proactive health management, easing the economic burden for healthcare costs. That's kind of the objective around it. And of course, true progress lies in inclusion, bringing more communities into the fold with better information and infrastructure and investment in how we build a healthier and more equitable India. I think that kind of sums up. If we bring together more information, more access, we'll have savings on healthcare expenditure.
Yes. And coming to companies like Haleon, I mean, you are already doing such wonderful work. There are other corporates who have healthcare initiatives, or there would be some who want to enter this domain, larger companies as well as medium ones. So, what suggestions would you give them? What should they look out for? Where should they focus their efforts? Sorry.
I think it's a very important piece to be able to look into the communities and look into the areas where you have a little bit of an expertise. Because, like you said earlier, healthcare is a huge subject.
Right.
If we all try and address everything, we'll probably be very scattered and very thin. So if you can go deep, take a particular area of healthcare. Like for us, oral is a very important area. So we've taken oral healthcare as our primary objective, and we're trying to go deep into that. Then, all our knowledge around pain management, our bone health is a little deep. So we've got primary healthcare there. We have a portfolio on respiratory, so we understand how much respiratory issues can lead to other bigger issues. So we've gone into those areas. So I think the expertise that lies in your company, if you focus on those and go deep and make a sustainable impact, it will be good. Doing projects short term, not really staying to improve the quality of the health, really don't really have an impact. Money is spent, but you not brought them to the proper healthcare. So I think that is an element that we must make sure organizations who want to go into healthcare make a commitment for long term and very deep in a particular area, because healthcare is quite wide.
Yes. Yes, that's very pertinent. And what are your plans for the near and medium future? What's taking your time? So,
Yes, from a long perspective, so we've run these 5, 6 projects that we have. We want to continue to run them in a very successful manner and keep building on it. So, Smile Train was a journey we started in 2018. We've built on it. Our mobile units also, we tested, starting with 1 or 2 vans, and now we are now 9 vans, 3 on primary, 6 on. So we will continue to build in. We will continue to make sure that we have long term support in the areas that we go into. That's our medium to long term impact. And of course, we will go back and see what impact we've created, work with the society groups also, because things will change. What we needed 5 years back may not be something we will need 5 years from now. How can we get improved healthcare? How can we improve the access? What is it that we can do at that time? We'll start prep for that.
okay. Well, that was it. And thank you, Shanu, for such a crisp, beautiful interview. And it was totally very informative. And rarely we are able to, pack up an interview within the time limit, but this is probably one of those rare times. So thank you so much.
Thank you
And
so much.